So this is our 28th annual economic forum, and it's our very first virtual one, which is a very unique situation to be in. I think this last year has been, we'll call it unique. I think unique, pivot, like these are some of the words that we've been using to describe this past year, challenging, difficult. And the interesting thing about this is that the Economic Forum has focused on difficult times in the past. In our 28 years of doing this, we've certainly experienced recessions. We've experienced loss of industry. I remember when Sikorsky left, that was hugely devastating. We've seen industry challenges and changes like we did with hydrofracking. But I think this is probably at this point the greatest challenge that our community has faced and probably will face in our lifetime. And you know, what's interesting about this is it's definitely has impacted business across the board. Every business, every type of business has been impacted by this. Every individual has been impacted by this. But what it comes down to really is a healthcare crisis that has impacted all sectors and industry. And, you know, that's why we're looking today to our healthcare professionals to shed light on the past year and the challenges that they experienced, as well as, you know, what we can expect as a community moving forward. So before we get into this, I want to take a minute to just note our speakers. We have Jonathan Lawrence, who is President and CEO of Arnett Health. Thank you, Jonathan, for joining us. We have Paul Vervallen, Executive Vice President and Chief Operating Officer for Guthrie. Thank you, Paul. And we have Dr. Richard Terry, who is Associate Dean of Academic Affairs at LECOM at Elmira. I also want to acknowledge that on the program today, we are joined by County Executive Chris Moss, Deputy County Executive Dave Sheen, and Senator Tom O'Mara. Thank you all for joining us. And I really want to take a moment to thank our sponsor, Elmira Savings Bank, and President Tom Carr for their continued sponsorship of the forum. I'd also like to thank Chamber Chair Michael Printup and Watkins Glen International. They provided a grant which offered complimentary admission to small businesses. This is such an important topic. We wanted to make sure that everyone was able to attend. I want to thank STEG Senior Economic Development Manager Jill Koski and President of STEG Joe Roman, as well as STEG Chair Jan Vandenblink. This is a partnership between the Chamber and STEG that produces this program annually. And I want to thank our program facilitator, Dusty Hewitt with Long Run Communications. Thank you, everybody. So we're going to actually start with a poll question here just to get everybody familiar with that. Before hearing from our panelists today, how confident do you feel about the local response to COVID? And you're going to see a poll come up on your screen and you'll be able to interact with that. And we'll be collecting data from that throughout the program to share with our presenters and with our audience. You should be able to see the poll now, and you can just simply answer it. Submit, as I said, this is completely anonymous. And I think, you know, when we look at what the community has done here, when we look at what Arnett Health, Guthrie, LECOM, and the County Health Department have really accomplished for us, it's been pretty remarkable this last year. And I think everybody on this meeting today, this forum today, appreciates all that you've done. And I know we're all really looking forward to hearing from you and seeing, I see Dusty shared the results, and seeing, you know, kind of like what you've experienced in the last year from your perspective, because you've been in the trenches with this, and what we can look forward to moving forward. So we'll see the poll results here. I'm glad most people feel pretty good or very good about the way that this has been managed. I'm going to hope that by the end of this program, everybody is feeling a lot better about how we've handled this situation and how we're going to be handling it in the future. So I think that response is really strong, and I'm glad to see it. So without further ado, I'm going to welcome our first speaker, our first panelist today, Jonathan Lawrence, President and CEO of Arnett Health. Thanks, Jonathan.
Good morning. Thank you, Kamala. And I would like to also join in expressing appreciation to STEG, the Chamber, to ESB, to WGI for sponsoring this event and for all their support throughout this. I'm pleased to be again joining Rich Terry and Paul Vervallen. They and their organizations have been tremendous partners and have made significant contributions in addition to the work of the local health departments, as you mentioned, and many others in keeping our community safe and moving us back to normal. And it's really an honor and a privilege to be here with them. I'm going to be presenting here quite a number of slides. and recognizing that all of us are now probably Zoomified, which I think will be a designated medical condition by the time that we get out of this. We're going to be moving very quickly through this. So I'm simply going to touch on a number of themes and address where we've come from, where we are now, and where I think that we're going. And within 10 minutes, it's going to be a whirlwind of information that we'll be able to delve into further following the presentation by my colleagues on the panel. So, Dusty, you're going to take off for me here. Let's go. And I won't read these to you. You can read them yourself, but here's a quote at the outset of the pandemic. So we know that COVID is going to reshape the world. We don't know exactly how yet. And we can think of other things like the 9/11 situation, when so many things have changed permanently. And we're still trying to figure out and learn what's going to change in the future. Next slide, please. Here are all the elements that are going to be impacted by COVID. Things that most of us have already experienced or have seen, but maybe have not fully appreciated. Again, we just don't know yet how things are going to change, and things are changing literally on a daily and weekly basis. In each of these realms, some of them will permanently change how we interact with one another, our businesses, our community, with healthcare, with technology, and so forth. Next slide, please. So, some of the initial challenges that we had to deal with here very quickly. New York was the first state in the country dealing with COVID in such a significant way. We were fortunate because we had been working with, Arnett had been working with Dr. Lappy and folks at Corning Inc. already. We knew that they had a plant in China. So we had a bit of forewarning that something could be happening over there. And if people stepped off the plane here in Elmira, what would we need? What would our processes be to respond to people with symptoms or concerns? Never, frankly, at that point, dreaming that this would spread the way it has. And so, here we are today, having completed more than 54,000 COVID-19 tests. And when at the time, PPE was initially in such short supply, we now easily have over a year's worth at any of our sites, and in some cases, much more than a year's worth now available. Next, please. Patient safety, staff safety, physical space. You can see in the photo the barriers that were put up. The acquisition of ventilators. We thought we were going to need them far more than we did. We got to work. We were able to bring in more than a dozen ventilators before they became impossible to get a hold of. Cardiac monitors, all kinds of things. Our responses, initially state mandated canceling of all elective procedures, and then quickly right-sizing the organization, cross-training. Arnett has 3,000 employees. When you start shutting down services and locations and access to care, how do you redirect the work of that workforce in a way that's going to ensure effective care and safety, not only for our staff, but for the patients and for the community? And so we had to work with our partners. There was a lot of regional collaboration. It was load balancing, what we call load balancing of patients. Paul and I had calls on a number of occasions just to see where are you at in terms of your census and what might be coming down the road, ideas for things that we can be doing to work together. A tremendous partner in that process. And then regionally, the Hospital Association helped facilitate some calls. And we were talking about this with many other hospitals and facilities throughout the region. Next. Dealing with, again, employee health issues, making sure that employees knew that their safety was first and foremost in our minds, and that they could access employee assistance, crisis intervention teams, making sure we were taking care of their mental health, particularly as the crisis went on. And then we were beginning to see patients who were succumbing to the disease. You know, at first, we really didn't have very many patients, and it wasn't an issue that we thought we were going to confront until much later on in the fall. And then we started to see a resurgence, and we started to see significant numbers. And then we had to designate entire units to nothing but COVID patients. And then we started to see patients succumb to COVID. Very tough for staff members who are suited up, gowned up, living in PPE all day, and taking care of people, in some cases for weeks on end, on ventilators, only to see that their efforts were not successful ultimately. Really very, very challenging. Next slide, please. We also had to focus on communicating effectively with our patients and letting them know that we had resources available for them to stay in touch with their families and to help families and patients, because the patients that came in the hospital were pretty isolated. Visitation had been suspended. And so how do you deal with that as a patient or as a family member when your loved one is in the hospital? So communicating with our patients, our family members, their loved ones, making sure that we were confident about our visitor restrictions and enforcing them equitably and reasonably, but making sure that we weren't allowing infection to spread throughout the facility. Next. The community was tremendous in their support. The donations from so many of your organizations and community members really helped us, not only in terms of the tangible assets of those donations, but I have to tell you, it was a tremendous boost of morale to the staff here, who could often and easily feel isolated within the boundaries of hospital facilities. So thank you for all the meals and the masks and everything that you had donated, and the words of praise and appreciation. Next, please. And these are just a few of the organizations that pitched in to help out. Next, please. Speaking of donations, probably the most important one came in the form of an ultra low freezer. As you know now, this type of a freezer that can keep temperatures cold at 80 below centigrade is essential to maintain the Pfizer vaccine. And so that was the vaccine that was first released for healthcare workers. We were able to get one thanks to the generosity of U.S. Fish and Wildlife up in Cortland. I had known somebody who had just recently retired, who knew somebody who worked there, who said, you know, we have an extra freezer that we're not even using. They were very quick upon request to be able to facilitate the paperwork, cut through the red tape, get it down to us. We put it in service in time to be designated to be able to be the site for a hub site initially for about 15 hospitals throughout a very broad region of New York State. And we vaccinated the first 1,000 employees in that region because of that generosity. And we continue to use that freezer and keep it in service. Next slide, please. These are most, if not all, the vaccine sites now that are operating by various providers. So not just ARNet, but the county, the state, and other providers of vaccines. Next, please. And those are a few of the sites in Steuben. Next, please. These are some of the sites where we've held vaccine events. And in particular, I call attention to those who have been, who are folks who are underserved, disabled, homebound, or living in community residences. We've been working hard to be able to reach out to them and make sure that they had access to vaccine at their residential place of location. I know the county has done that as well. And many other organizations have also been represented in that effort. Next, please. There's Steuben County, a few of the organizations and places where people with disabilities and other special needs have been able to be vaccinated. Next, please. Yeah, so Again, many thanks to Peter Dugo and everyone at Arnott Realty for making the Arnott Event Center possible. That has been the site of our mass vaccinations, and that is how we've reached the goal of, or at least the target right now, of over 30,000 vaccines given to date. Next, please. Yeah, and next, please. And so, overcoming vaccine hesitancy in the community and making sure that everyone who is eligible gets vaccinated is going to be absolutely critical to returning to normalcy. Here we have Dr. Pallavi Kamjula, one of our physicians here, showing why she got vaccinated, because she cares about her community. And we've asked others to please share the reasons that they've gotten vaccinated on Facebook and social media and other places. Next, please. So if you can't see this, people sitting at a table saying, are you ready for the new normal? Are you talking about the new normal of an hour ago? Or is there a new normal right now? And I think we've all felt that way. Do you wear a mask? Do you not wear a mask? Inside or outside? What are the rights and responsibilities of those and privileges of those who've been vaccinated versus those who haven't? How late are places open? What has to be closed when? What are the capacity limits in different types of venues? Visiting hours and restrictions. Too many things to mention here, changing on a daily basis. Next, please. So the national healthcare impact. Here's a slide simply depicting, this is actually British Columbia health system represented. But I think this accurately portrays the challenges that we have in the United States. You have all these problems and already existing in our healthcare system, and then on top of that, you land COVID-19. These are the things we'll be talking about later, and this is really a tremendous challenge on the system. Next, please. And these next few slides really just talk about the fact that there's been a change here that will be probably permanent or at least long-lasting. The shift in demand, regulatory changes, reimbursement changes. These are all things that are going to have, I think, permanent effects on the organizations that provide care and where and how and when we get care. Next, please. So half the hospitals, rural hospitals, were already operating in the red before the COVID-19 crisis. And you can see that healthcare and medical bankruptcies were among the most bankruptcy filings in 2020. So how is this going to play out now following COVID? I think you're going to see a lot of changes, a lot of continued mergers, acquisitions, downsizing, consolidation in the market. What is that going to mean to all of us, both as consumers and providers? Next, please. So one of the things that we've learned, some of the things that we've learned here and are seeing are the needs of diverse and vulnerable populations, people who are already living on in very challenging circumstances, living with fractured support systems, lack of support systems. COVID has really had a profound impact on them. And so how do we make sure that we have systems in place and support networks to care for their special needs? Next, please. And that is true also of people who live in rural areas. We've learned that those of us who are already working in rural healthcare know that there are disparities, preventable differences in outcomes due to living in rural areas. But we see a huge impact across the country now as well that we're going to have to pay attention to. Next, please. So what role will technology play here as other things come to fill the gaps when access to providers is suspended or terminated or disrupted in some way? One of the questions that we're seeing come to bear is, where does technology come in? And so now that you can check your blood sugar, you can check your heart rate, you can check for arrhythmias, you can do home testing, and so many other things, bypassing your primary care providers and the places that are bricks and mortar. How is that going to reshape, and what type of an impact will that have on our access to healthcare and the behavior of our healthcare providers? Next, please. And so this just represents the fact that, Arnott, Guthrie, you name the healthcare provider, we're competing now on a national level with large, well-funded national players who can be reaching out to our patients and to our community members to provide services in ways that have only been through hands-on, face-to-face care previously. Next, please. And so the strategies that we're going to need to succeed in the future, I think, include focusing on quality, focusing on how we can extend that technology out to patients in a way that makes sense, making sure that we're offering the right services in the right places, and working together strategically, finding new ways to work together to provide services to our community members, regardless of their rurality, their ages, their particular needs or challenges, and make sure that we remain vital in our communities. Next, please. Same points here. Making sure that we focus on supporting the patient and provider relationship, and that we're inspiring trust and confidence in our patients, cultivating their loyalty, making sure that we're providing stellar service. So the millennium generation is happy to go on social media and download a chat or an app and get their healthcare from people who may be thousands of miles away and somebody that they may never see again. That's a very disruptive technology to the services that we have in place here. And those services will not be able to be sustainable over time if all we're doing are the most critical things that you need a bricks and mortar hospital for. It just won't be able to be supported by the revenue that we'll all be generating at that point. So reinventing ourselves to make sure that we remain vital and that we are inspiring the trust and confidence in providing essential services to our community members will be part of our new normal. Next, please. And some of the cartoons and images that we're seeing now about how physicians and others are reaching out to show that they're empathizing with their patients and making sure that they're providing service and keeping their patients local. Next, please. Recognizing the importance and the value of our staff, probably the next biggest challenge. So retaining our patients is one thing, but also retaining our staff and the competition for staff, the commoditization of the workforce, the incentives now, the financial incentives for staff to be traveling. I'm talking to you off-site today because I have a family member who's a patient following major surgery at an academic medical center. His nurse in the ICU today is a traveler. It is somebody that is a New York State resident, but left one area of the state and came to this part of the state simply because he was being paid more money to come and work here. How do we as institutions continue to cultivate loyalty to the community, loyalty to the institution, talent, and make sure that we have high-performing staff when we're faced with essentially the commoditization of the workforce, where the job goes to the place that's offering the most money, and you can see that person or individual leave in a matter of weeks to go and get the next job after a few months on site. Next, please. So the healthcare workers, indeed, the frontline staff have been the true heroes here of this pandemic. They have met with countless challenges and continue to do so. We're incredibly grateful for their sacrifices and their efforts. And I think it's appropriate that this seminar is happening during Nurse Appreciation and National Health Week here this week and next. So grateful for this opportunity to talk with you today and look forward to the rest of the discussion and talking about some of these issues in further detail. Thank you.
Thank you, Jonathan. And I did not know that that was that appreciation week. So I think we're all incredibly appreciative of the work that healthcare professionals have done during this time and understand the huge sacrifices that they have made to keep our community safe and to be at the forefront really of this crisis. One of the things you talk about is it seems like this crisis really has made institutions from the business community side, but also from healthcare to really innovate and kind of level up and take it to that next step in terms of even, efficiencies and partnerships. And although I'm sure it's very challenging, I think it's also encouraging that, in a crisis, it also is an opportunity to change and grow the way that we do things and do things better. And I think that the best success we've had as a community so far has been in finding those shared solutions and pathways forward that are, even more kind of progressive for our community as a whole. So I appreciate all the partnerships that have taken place from the healthcare industries. Somebody noted in the comment today, today's National Nurses Day. So that's highly appropriate. Wonderful.
Absolutely.
So while we're here, I want to do another poll. I don't see any questions, but I'd like to ask the audience to do another poll. We'd like to ask you from the business community, what % of your employees are vaccinated? This is something that I know we're kind of curious to hear. So we'd love to know, ballpark figure, how many of your employees are currently vaccinated. And that's something I can say too, that every facility here, the county facility up by the airport, the facility at the Arnett Mall that Peter Dugo helped put together, have just been tremendous. Have just done such a great job. The one over at Corning Community College that I know Guthrie was very involved in, like, it's just been wonderful to see each of these facilities run so well and so efficiently and effectively in this really tremendous task of getting our communities vaccinated. So we'll see the results from those polls here in just a second. There we go. Okay, so that's interesting. Looks like we're kind of holding in the 26 to 75% as a whole. And obviously a lot of businesses aren't sure. It's one of those questions that comes up that's difficult to handle from an HR perspective, which has been another sign of this last year, is that all of a sudden HR has had to deal with all kinds of personal and medical related questions that normally we try to avoid. Thank you. So with that, we're going to segue into our next presenter, Paul Vervallen, who is Executive Vice President and Chief Operating Officer for Guthrie. Welcome, Paul, and we're looking forward to hearing your commentary.
Thank you, Kamala. I appreciate it. Well, I have to tell you that it's a privilege and an honor for me to be here as well and to sit on this panel with Jonathan Lawrence and Dr. Terry. And a couple months ago, when we gave this presentation at the Chamber Board, Jonathan gave a fantastic presentation with great slide decks or deck of slides as he did today. And so I knew that I was banking on the fact that he would do the same for this presentation. So he did not disappoint me. And so therefore I'm just going to speak because otherwise my slides would have been subpar and definitely I would have duplicated most of what he said. It's been a great, privilege to work with Arnett and other health systems throughout this very, very challenging time. I refer to the quote of Charles Dickens. It was the best of times and it was the worst of times, right? So we saw some enormous superhero actions on behalf of so many community members and our healthcare workers and our leaders, our government officials. And yet it was the worst of time. Jonathan had noted some of what Arnett had experienced, same with Guthrie, where we saw loved ones who had succumbed to the disease or the virus and could not have their loved ones with them. And that was a challenging time for all of us, especially the healthcare providers that were caring for these patients in our facilities. Just like Arnett and many other healthcare facilities across the region and across the nation, we also had challenges in the beginning. We shut down much of our ambulatory environment and surgical environment. We lost a tremendous amount of revenue throughout the beginning stages of COVID, moved very, very quickly to a telemedicine platform. Guthrie had a telemedicine platform, so we were benefited by that compared to most who had to quickly pivot in terms of telemedicine environment. However, we had to ramp up dramatically, just like every other health system. And that was a little bit of a challenge to get our providers up to speed in terms of caring for patients. Our testing environment was challenged. We had to send out most of the tests that came into our facilities, long turnaround time. We struggled with obtaining kits, and that was a challenge as it relates to trying to deal with this virus and caring for patients real time. Supplies, Guthrie was a just-in-time inventory shop, just not unlike most businesses or other healthcare systems trying to reduce our costs. And our critical supplies were very, very challenging in the beginning. And besides that, prices all of a sudden skyrocketed for us. And where we might have paid 5 cents for a glove, all of a sudden we're paying $5 for a glove. And we also had to deal with black market challenges where people were trying to create schemes in order, unfortunately, to take advantage of the situation. So a lot of challenges relative to supplies in the beginning. Jonathan noted staffing concerns. Our staff early on were scared. It was important for us to make sure they were protected and they felt safe. But yet we had to also pivot the organization because we shut down a major portion of our organization. So unfortunately, we found ourselves not unlike other businesses. Many of you in this room had to furlough employees or had to make that unfortunate decision to send them home. And we had reduction in salaries that were warranted in terms of our executives, and our providers all took a pay cut in order to make sure that we could sustain our businesses. So a lot of economic challenges and a lot of pressures early on, just as all of you have experienced in your environments. And then finally, our facilities. We had to pivot in terms of how we care for patients very dramatically and make sure that we set our existing facilities up with social distancing and making sure that we kept people safe as much as they possibly could be kept safe coming into our facilities. And I would think, although some people have shared with me that they would think that it was less impactful, but the patient restrictions in terms of visitors really impacted not only our patients, but families and our nursing staff and our healthcare providers. That was a very painful moment, and we still deal with that a little bit today, although restrictions have been eased somewhat. We still have to, we're challenged with explaining to patients why they can only come into the facilities a certain amount of time and not in groups as they were accustomed to doing. However, with all our challenges, there have been successes as well, and there have been positives. I'm an optimist. I think of things from the glass half full perspective and encourage our staff and folks, community members, to do the same. We have had an unbelievable amount of community support, just as Jonathan had denoted. Businesses, small and large, the health departments, public health departments, our government officials, citizens, the healthcare environment, the healthcare community. Before, and I'm somewhat embarrassed to say, before COVID, our health systems, we collaborated and we talked to each other, but we really didn't collaborate. And this has really formed a great relationship, and we have an unbelievable amount of respect for ARNET and our other health systems that service our communities and our patients. And we realize, I think all of us realize as healthcare providers, the important role that we play, and we can do better when we work together. And we have shown that collectively. Teamwork has been so important, both internal and external, throughout this endeavor. And the health system collaboration and the business collaboration has been paramount. Jonathan showed a little bit in terms of some of the slide decks relative. I think I'm going to actually borrow his slide decks at some point in time. But Guthrie and ARNET teamed up quickly relative to messaging and testing and encouraging the public to get tested relative to COVID, and safety precautions, making sure that we were following safety precautions to keep our communities safe. And now with vaccines, you see both Jonathan and Dr. Scopoletti out in the public, making sure that people are getting the message so that they are less hesitant to getting the vaccine. We, as a system, we have collected over 120,000 specimens so far relative to COVID, and we are continuing to improve our process. And so currently we're installing high throughput analyzers throughout Guthrie that allow for the ability to test specimens in quick fashion and within 24 hours or less. And I believe the other health systems are doing very similar. This will help us in terms of making sure that we'll enable symptomatic and exposed patients to get back to work and get back to school and feel more safe, get out of quarantine, so that we can get back to normalcy, so to speak, as has been denoted before. We see from a care delivery perspective that we have to redesign how we care, our facilities, and the use of technology. Jonathan had mentioned that. Just as ARNet has built up their supply, we now have a supply warehouse. So we've migrated from just in time to a warehouse of supplies to make sure that we are prepared if in fact this happened again and we needed those supplies to care for the community and make sure that we, along with our healthcare partners, are in fact prepared more so than we were at the beginning of COVID. And of course, the mass vaccination sites have been very, very successful. Jonathan showed a map showing those, and we also have participated in those collaboratively. On the New York side, we have a mass site in Pennsylvania as well that's open to any citizen regardless of residency. And so those have been extremely important and collaborative. To date, we've done about 60,000 doses. About 35,000 individuals in our region have been fully vaccinated, but that is still not where we need to be as a community. And so we are continuing that effort. So today and beyond, COVID continues to linger. We still deal with it. I think we're dealing with it in a very different way. I know we're all dealing with it in a very different way. It is still a concern for us, especially as we care for patients and we watch the virus impact the people that we care for in the hospital, although clearly the numbers are lower than they have been in the past. Currently, we have about 28 patients as of today in all of our hospitals, but that's about 8% of our acute care beds. So we are celebrating the fact that the virus is dropping in terms of number of cases that are hospitalized. However, we are still diligent in making sure that we are prepared and encouraging people to take heed and use precautions and get vaccinated. Our facilities are open, pretty much fully open, just as I believe ARNet is as well. And we are doing our best to get back to normalcy as it relates to care for patients, encouraging patients. One of the things that we all experience is patients were very hesitant at first, and that's easing up, but we're encouraging patients to not hold back. If they need care, they need to come in to seek care. Our facilities are safe, regardless of whether or not it's at Guthrie or ARNet. We are here to care for the community. And we've seen a lot of cardiac disease and other ailments that people have just been holding back. So by the time they get to us, it's more severe and more of a challenge than if they had come to us from the onset. So we're encouraging people to seek care as they need it. Staffing is a concern. Jonathan denoted it well. We have, at one point in time, we had 6 nurses resign in one day to go be a part of a traveler agency. So and I'm sure ARNet has experienced as well. This is a real big challenge, and I think it's a challenge for all of the business community to get skilled workers to apply for jobs. We see that not only in healthcare, but also we're experiencing it as we talk to all of our industry partners. So volume has rebounded for us, though. We are very, very thankful for that. We see people that are feeling more comfortable coming in, and we are encouraging them to, in fact, do that. And we are encouraging people to get vaccinated. We continue to hear the debate that's out there. About 70% of Guthrie employees have been vaccinated, and we're celebrating that. We are consistently encouraging people to do better, and that we must continue that message that the vaccine is safe and that we need to get to the herd immunity. And herd immunity from our perspective is, it ranges, but at least 70% of the community should be vaccinated to get herd immunity. And some infectious disease experts claim that 80 to 90% need to be vaccinated in order to celebrate herd immunity. Dr. Terry may very well comment on that better than I, being a clinician. And we're just not there right now. I think that both, within our service area, I think the highest in any county, except for Tompkins County, is 45% in Broome, 30-some% in Chemung County. Steuben is about 35%. Bradford County in Pennsylvania is 27% vaccinated. So we must all, I think, as a community, business and healthcare community alike, continue the dialogue and encourage people to get vaccinated. And very similar to ARNA, and we'll put the offer out there. I'm sure my ARNA colleagues, and I don't want to volunteer them, but if you as a small business, or if you as a business community, if you cannot get your employees, if you have a bolus of employees that you want vaccinated, we'll come to you. The mass sites are out there still. We are struggling a little bit to get schedules filled, and so we're pivoting and making sure that they stay open, but we will come to you if you need us to come to you to vaccinate your employees. If you can convince your employees to get vaccinated, we will partner with you. So like Jonathan, I think that we don't know what the future will hold for us. However, we are pivoting along the way. We're working collaboratively with our partners, and we're honored to do so. And we are continuing to encourage people to be safe, continue to wear masks as much as we possibly can until we can get that herd immunity and get people vaccinated.
Thank you, Paul. And I think the message we're hearing for the business community and how we can best support your efforts is mask up, vax up. And yes, and if there are businesses that would like to have employees vaccinated, definitely feel free to contact the chamber, and we can connect you with healthcare professionals and industry to come and do that at your place of business. We're going to roll another poll here really quick. I would like to hear from the business community. Are you considering mandating or encouraging your employees to receive vaccinations? This is something that's come up. I know from a legal issue, we've been told, you probably shouldn't mandate it, but you definitely can encourage it in creative ways. And as Paul was saying, and I'm sure Dr. Terry is going to speak to this more, and certainly it's something I don't know much about other than what I've read, is that herd immunity is so important, and having people participate in the vaccinations. And really what we want as a business community is to get people back to work and be able to have children in school and have that return to normalcy as much as possible, because that's what keeps the economy moving forward. And it's so important for us to support you in those efforts by, encouraging the community to mask up and vax up and get to that point. So I'll be curious to see when the poll pops up here, how many businesses are considering doing that. So yes, 38%, no, 21%, not sure, 43. We have been hosting some seminars on this issue. So if the business community wanted to kind of look at the pros and cons of that, I believe we have a recorded session with Michael Schiatti, who's the attorney from Barclay Damon, on this specific issue. So we do have some pointers on that for the business community. And now I'd like to welcome our third panelist, Dr. Terry from LECOM at Elmira. Dr. Terry is the Associate Dean of Academic Affairs there. Really looking forward to hearing from you, Dr. Terry, and thank you so much for joining us this morning.
Oh, you're welcome. Thank you. All right, excellent. So I only have one message today. I only have one. If you're not vaccinated, you're going to get vaccinated after my talk. End of discussion. There's no way out of this without vaccination. Nothing. Let's not be fooled. Nothing else matters. We did the best job we could, the health systems. It's impossible. It's an impossible situation. Never dealt with this before. And it's been politicized more than anything ever. And it still is, which is why we have such vaccine hesitancy. So we've got to get vaccinated. So I saw the employee numbers were maybe around 50%. It's got to be higher. It's 95% at LECOM. among our employees, and it's 95% of our students. And by golly, it'll be 100% by July. So we've got to get everybody vaccinated, period. So we're going to talk about vaccines, variants, and reality. Let's put all of this in perspective. So next slide, please. So we've made great progress. You know, the numbers had spiked. We're looking at the New York numbers. These kind of mirror the rest of the country and Chemung County. We've done very well. We had a big peak around January. It's come down, steadily come down. But let's be honest, it's come down now because of the vaccination. Places that have done better with vaccination, it's dropping. All one has to look is to Israel, where every age group that they vaccinated, they've reduced the hospitalization rate. And then I hear, oh no, Dr. Ter, if I get vaccinated, I could still get it. Well, you can. My son did twice. He managed to give it to my wife and he got it again. I'm like, Rob, how the hell did you do that? He's vaccinated and he had COVID. Are you sick? No. So listen, the vaccination prevents death and hospitalization. You could still potentially have a subclinical case and you'll need to quarantine. But the idea is to prevent death. No one dies who gets the vaccine and doesn't have an adverse effect, which is very rare. We'll touch on that. And dies of COVID, and they don't end up in the hospital. So the vaccine is incredibly effective. It is one of the best vaccines that we actually have available. It works, and it's the only way out. We're going to still see bumps in this until we get to, Paul mentioned 70%. Yeah, about that. We got to do better. A lot more vaccinations. That's the only way out. If not, we're going to continue to see spikes in little hospitalizations. And we've made great progress with tests. What other test other than pregnancy can you go to the pharmacy now and check your COVID status? I mean, it's incredible, the research that we have and the availability of these tests. If I had to say an area where I thought that, you know, vaccinations could have been better, and this is a federal mandate, is I might have given it to some of it to the physician's offices. Because where I find now is I saw 3 patients today, 3, and I'm pretty adamant, as you can tell about back, who didn't get it. And I said, you've got to get it. Really, Dr. Terry? I said, yes, you're going to Rite Aid now. Okay, I'm going to do it for you, doc. Okay, listen, do it for me, but do it actually for your grandmother. Do it for your mother. That ability to persuade people is a bit lost because we kind of have that disconnect. So I'm hoping that physicians can be more involved in advocating as we do for flu shots, because it absolutely makes a difference. So next slide, please. Chemung County, we've done great. These numbers are better. Our numbers are dropping. The hospitalizations have dropped. Everything's dropped as the vaccination rates increase, but we're a little lower. We're a little lower than some other areas, but you know, rural areas in general are lower. There's a lot more hesitancy in rural areas for vaccine. There's such misperception out there. The cyber chip, all of these things that we're going to be monitored with vaccines. And one thing we've done is the media just promotes the negative. Whereas if you look to UK, where they've achieved nearly a 60% vaccination rate, they control that a little bit better, and they don't dwell on the negative, the complications there were with J&J with the suspension. But after that, we were doing great in the States. But then after the J&J, the vaccination rate has dropped everywhere because people are afraid. And then the common thing I hear, well, I'm going to wait. Well, what are you going to wait for? Till you get COVID? Till you get COVID and someone may die from it? The problem with COVID, it's not the flu. The problem with COVID is some people can get really, really sick and die. And they can be young people. It's not just old people. And unfortunately, I've seen that, among patients and among family. This absolutely happens. And, you know, we're dealing with the other reality here. So if we compare this the most to the Asian flu, and probably most of you weren't alive, and certainly I wasn't, but that was in the 1950s. And that killed about 4 million people. But it didn't have this kind of effect. One interesting statistic then, we had about 10 beds per 1,000 in the hospital per 1,000 people. All we've done now with hospital systems, because healthcare is all moving outpatient, is contract. We have about 2.2. So the problem is we get hit with anything. A massive pandemic, a massive flu, hospitals will be overwhelmed. There's not the beds anymore. So more and more vaccines matter. We got to try to be ahead of this. What we've accomplished now with getting a vaccine in a year is remarkable. It took decades for smallpox, decades for polio. We did this in 1 year, and now we're getting on the other side of this. But vaccination is absolutely the key. Well, let's talk about the elephant in the room. Next slide, because we've got to talk about what in God's name is happening in India. Let's put this in perspective because it's being blown up all over. Here's the problem. Less than 2% of the population has been vaccinated. That's what's happening. And they don't have healthcare like we have. They don't have hospitals. They don't have beds. It's blowing up. They thought they'd somehow escape this. They didn't. There's more variants, but the vaccinations just aren't there. And there's been tremendous vaccine hesitancy there and skepticism. So this isn't because there's this triple mutant RNA virus that's going to come here and get us all. There's not vaccinations happening there. And everyone, the rest of the world is doing their best to get them, but there's a lot of vaccine resistance and it simply wasn't available. But there is what's happening in a nutshell. Let's not think that it's more, and because then patients will say, oh no, Dr. Terry, look at India, no, they're not vaccinated. That's the problem. We've got to get people vaccinated. Next slide, please. But the reality is that COVID is this RNA virus. It's like a cold, like other COVID that our kids have all had, or toddlers that we may have had. So RNA viruses, unlike DNA viruses, they mutate. All they do is they change their genomic makeup. Every time they infect a host, they change and they'll mutate. This is normal. This happens. We've got the UK, we've got the South African, we've got the Brazilian, we have a New York variant too that's out there as well. They will continue to mutate. Here's the good news. The vaccine works against all of them. So let's put that to rest. The vaccine works against all of the variants as of today. A little bit less efficacy against some, but it works. But it works. Then I hear, well, maybe I'll have to get a booster. Okay, yeah, maybe you do next year. We get a flu shot every year. Fine, we'll do that. That means we're trying to stay ahead of this. So it'll mutate, but the vaccines work. Variants, yes, they're more contagious. B117 is ravishing this country for people who are not vaccinated. Who's getting it now? Younger people. Average age of hospitalization is about 58 now. Those are the people ending up in the hospital. Those are the people dying it. Mercifully, children don't die from this. They typically recover, and they tend to spread it and infect people who can get really sick. But fortunately, they don't. But the reality is high prevalence of these variants, where people are vaccinated, we're seeing a marked decrease. So the vaccination works against the variants. So you're going to get vaccinated, and we'll modify the vaccines going forward to manage these mutations because RNA viruses mutate. That's what happens. They typically continue to mutate themselves till they're done. They burn out. They become something more benign. To some extent, perhaps that's happening, but this will go on. We'll continue where we are now unless we get these vaccination rates much, much higher. People will still end up being sick. We'll have pockets. We'll have quarantines, and life will not be the same. Will never be the same, but it's just going to be slower. So, next slide, please. So right now it's B117. It's contagious. The reality is the symptoms are the same. When we looked at the studies, you're not more likely to die. You're just more likely to get it. It doesn't, this is very, very contagious virus. 2 minutes, 2 feet apart, no mask, someone has it, a super spreader, probably about 80% of the virus is spread by 20% of the people. That's what we think, who seem to be able to spread this. We're not exactly sure. But the reality is what we're dealing with is B117 for the most part. The vaccines absolutely work against this. It's not more severe, but it is more contagious. Next slide, please. So we're going to remember today, variants are going to occur. Doesn't matter what they say on television. Well, it's a triple variant, this is happening, but the vaccines work and we'll be okay if we're vaccinated. We will be okay. If we've had COVID, should we get vaccinated? Yes, absolutely. It'll boost your immunity. You're probably only going to need one of the Moderna or Pfizer. That recommendation will likely come out, and certainly just one J&J. So absolutely, yes, get vaccinated. It'll increase your immunity by 1,000%. So absolutely do it, and you'll be okay. You're not going to get sicker. You're not going to get COVID again. You may have all the minor side effects, which I'll talk about. Next slide. So the reality is Israel's doing it right. England is doing it right. The positivity rate is dropping precipitously. precipitously. They're at a function, they're now, much even less than these numbers that I mentioned because they're doing it right. One of the things they did is they removed some of the bureaucracy, like when my 85-year-old neighbor is trying to go online, she doesn't use the internet, to get her appointment, and my 25-year-old daughter and her boyfriend have already received the vaccine. Something is crazy. And the vaccine, it was just, unfortunately, a lot of the regulations that were put out there of age groups that were mandated by the federal government made it very challenging. Israel made it available for everybody. Get shots in arms, period. Go everywhere, whatever incentives we can do, go to get a free drink if you get a shot, whatever we can do. Let's just give vaccines to everybody now. It's available. And as I predicted, now we'll have a surplus. We'll have more vaccine than we need because people aren't getting it. Next slide. So the reality is, even before the vaccine, COVID was declining precipitously. We were seeing a decline in this. And with the vaccine, these numbers are even much better. But this 70% decline really started since the vaccine started rolling out. So we're continuing to see this steady decline of new patients and the age group. About 90% now of people, above the age of 75 have been vaccinated. That is wonderful news. We protected the nursing home patients, we protected the vulnerable, and now that resistance is happening in people who are a little bit younger. And they think and they say, well, geez, I'm not going to get it. My immune system. No, not your immune system. You're lucky. You're just lucky you didn't get it. That's the reality of it. So next slide. So what do we have? Pfizer, Moderna, they all work. Can't do better than 95%. There are no allergies. Let's put this in perspective. So allergies, if you have polyethylene glycol or polysorbate, 0.0000, no one has these. And if you do, we'll have the EpiPen there. We'll be right there with you. I've even told people, I will go there with you to get the shot. I will hold your hand and I'll have 2 EpiPens ready if you have any reaction. Get the shot. Okay, you can vaccinate 90 days after if you've had COVID or been treated with the monoclonal antibodies. And it doesn't change. If you get this vaccine, it's not going to mess with your genome. You're not going to change your DNA. It doesn't cause infertility, and pregnant women should get it. All right. There's some concern about women under 50 with J&J. There's some clotting disorder. We're not sure yet. It seems to be safe, but the others, Moderna and Pfizer, they're plentiful, and certainly those are available. Next slide. Here's what we have. The Moderna and Pfizer work on the RNA, messenger RNA, and the J&J is more of a traditional vaccine with DNA. They all have excellent efficacy. Don't be concerned about the 66%. That's excellent for a vaccine. That means 66% effective against infection. The reality is it reduces the rate of hospitalizations almost 100%. That's what we care about. We care if you really, really get sick. That's what we care about. And these vaccines are all extremely effective. So you choose it, whichever one, just get it. Next slide. Side effects, those of you who had it, you're going to have a little pain, a little swelling. You may have some night sweats. You may have a little myalgia. You may be a little tired the next day. Chills, it'll resolve, usually within 48 hours. That's what we're seeing. Maybe a little worse with the second shot. That's it. You're not going to get COVID again. You're not going to lose your sense of smell. None of that will happen. None of that. In fact, people who have had COVID, who get the vaccine, actually seem to feel better. By getting that antibody shot, it seems to actually make a difference. So side effects really are minimal, as they are with most vaccines. Minimal. So the idea, I'll wait, I'll see, no. Get the vaccine. It'll cause no more side effects than a flu shot, if any at all. Next slide. But we got to just use precautions for now. We have to be careful. Masks, social distancing for the time being. The reason is because even if I'm vaccinated and I happen to get it and I'm with an unvaccinated person, potentially I could spread it. Potentially I could get it, not get sick from it, but then spread it to someone who is not vaccinated. See, that's the problem. If everyone were vaccinated, we'd be fine. The problem is we got about 60% of people in this region who are not vaccinated yet. And that's the number we have to work on. Next slide. So, you can gather outdoors with vaccinated people. You can go out to dinner with vaccinated people. You don't need your mask really if you're outdoors. There won't be tests for quarantining. There won't be domestic travel if you're vaccinated. And we'll just have to do this. How much longer? Till we get the vaccination rate higher. We've got to get it higher. How much higher? Probably 50 or 60%. We've got to do better before we can feel comfortable with that. And herd immunity would be somewhere around 70%. When enough people have been vaccinated or had COVID, then we can really feel safe. So for the time being, we function with masks as we're doing, but at least, we can function, whereas a year ago, we couldn't. Next slide. And we'll get to herd immunity. We'll get there. Actually, close to now 56% of Americans are there with the first shot. And, we're getting 3 million shots a day, but what's been happening is the number of people getting vaccines is declining. We've got to change that. So you as a business community, it's difficult to mandate because this isn't apparently an experimental-like, and it's legal challenges and such, but you certainly can absolutely encourage that. And if they say, well, I won't get sick, you're right, maybe you won't, but your neighbor will, or your coworker could. Would you protect them? We'd never even have this talk if this were smallpox and were deadly like that was. It would be abuse if you didn't get it. Everyone got it. So I think that's the perspective we have to put this in. Well, you may not get sick, but 3 other people could. And we really still don't even know. Probably 10 times more people have had COVID than even know it. There were so many, probably up to 10 times asymptomatic infections that are out there. Next slide. So it's available. The healthcare systems have been incredible. They've made it available. Despite the challenges of caring for these patients, they've done vaccination clinics. I think it's been remarkable, as has the county, as now of the pharmacies. These are all available. There is no excuse not to be vaccinated. So the message today is, if you're not vaccinated, you go get it today. And if your employee is not vaccinated, you tell them they need to get it. And your family members, there are no major side effects, and there are no major contraindications. And there's really no excuse not to get this. Because if not, we're going to continue to linger on, waxing and waning with little bumps of this, with little pockets of infection that will affect us in more ways than just COVID, economically, our health, and most importantly, our sense of well-being. So, thanks very much, Kimberly.
Thank you, Dr. Terry. I know if I did not have my vaccine already, I would go get it today, just because you're so motivational in that way. So we're at the end of our hour here, and I did want to just note that, we have one more poll question, and that is, with hearing about all these resources and the collaboration that we have here and the plentiful vaccines available, after hearing all this today, how confident are you as a business community in our ability to overcome this crisis? So we're going to pop that up there and see if we've helped everyone feel a little bit more confident with what we're doing here. Also, I do have a question, and maybe Dr. Terry could take this. Do you think there will be a mandate on vaccinations? I'm guessing that's probably from like a federal level.
I think there could be with schools as there are with other vaccinations. Absolutely. I think it's got to get out of this experimental phase at this point, but the answer is yes. And the question is, should there be? Well, of course. How could we expose other people as we do with schools? A lot of anti-vaccinators, and I know I have a lot of them, some patients, they have all kinds of crazy excuses, but to the point where the kids don't go to school. And part of it's driven because they don't want to be vaccinated, for goodness sake. So the answer is yes, I think it'll need to go that way. I think there'll be other restrictions coming forth for us, for those who are not vaccinated, definitely.
And we have another question for you, Dr. Terry. Do you have thoughts about vaccine availability to children and safety? And would children be taking this away from someone else if they were to receive it?
Okay, I'll answer the second part first. No, we got plenty of vaccine. And yes, probably by fall. They're testing, it'll be in adolescents, I'm going to say within 3 months, probably with children 2 to 16, probably within 4 or 5 months. Those tests are going on right now. The efficacy is fantastic, and absolutely. So they'll say, well, would you do it to your child? Well, the answer is yes. I have a 10-year-old. Tomorrow, I would get her vaccinated. You know what Isabella said to me? We're going to school. She's dad. She had a GI bug. Dad, I got to be tested for COVID. Dad, it's the 14th time you've tested me. I'm like, honey, you really are a trooper. Yes, I would get him vaccinated. Absolutely. These vaccines work. I mean, if you want to know why healthcare is where it is today, it's not because, we're so smart. It's because of vaccinations. Period. Period. The death rate is, when you used to live to age 50, now we live to 90. It's all because we reduced pneumococcal H flu. This is just one more iteration of healthcare to allow us to live better and healthier. It's a vaccination. This is the greatest invention of medicine is vaccinations.
Thank you, Dr. Terry. So we're ready to see our poll results, hopefully. Okay, so we've got pretty confident to very confident, and we'll keep working on that. I do want to encourage the business community, if you need assistance in connecting to resources, STEG and the Chamber are ready and waiting to do that for you. I know the Chamber has been sending weekly emails to our members with really important, all the important information that you need to know with regards to COVID, and STEG has been sending email correspondence through the IDA as well. So, we're ready to connect you to the resources you need to do your part to get our economy back open and functioning in a way that's back to what's probably going to be the new normal. So we're ready to help you do that. And I want to thank Paul Vervallen, Jonathan Lawrence, and Dr. Terry for joining us today. I want to thank you all for everything you're doing on, and the industries you represent to really get us through this crisis. And it's made all the difference. And I feel like, with Guthrie and Arnett and LECOM and Chemung County Health, we're doing a great job here in Chemung County and in the Southern Tier in mitigating this crisis. And we really appreciate your efforts collectively. So thank you all.
Add one thing to
Sure.
In a company, you want manpower. I got students. They will come give vaccines. They will do whatever you need them to do. All they want to do is community service. I've never seen anything quite like it. I just wanted to pass medical school. They want to pass and do all these wonderful things for the hospitals. And listen, we're here.
Let's put them to work. Absolutely.
We'll go, we'll do whatever is needed to help this.
Awesome. Thank you so much. So I want to thank our sponsor, Elmira Savings Bank. I want to thank STEG. And I want to thank Watkins Glen International for their help in having small businesses join us today. Thank you so much for this presentation. It will be recorded and available through the Chamber. And thanks everyone. If you have any further questions, don't hesitate to reach out.